Hello everyone, I wanted to talk to you about emergency care versus first aid in Chapter 9. So hopefully the bulk of what you will be doing as an early childhood educator is providing first aid as opposed to emergency care. Typically, what you're going to see throughout the course of a day in your program, you'll see your share of abrasions, cuts, minor skin wounds, bites, blisters, and bruises. With bites, as horrifying as that sounds to parents, that is normally child-on-child biting. And just know that that is age-appropriate behavior for children ages 1 through 2 years of age. It's a developmental stage that children may or may not go through. So the first aid for a human bite, for a child bite, is to wash the wound with soap and water. If the skin is broken, you're going to be aware of that and report that to parents if that is the situation, and recommend that they seek the advice of their physician if the skin is broken from a human bite. This also goes on to say that you're going to apply direct pressure to the bite. I've never seen a bite that requires direct pressure due to a lot of bleeding in the time that I've been doing this, but I have seen bites leave a very distinct set of teeth marks that are visible on the skin, along with a little bit of broken skin, but nothing ever to the point where you've had to apply direct pressure over an extended period of time. But of course, that's not to say that it can't happen while on your watch. You will have children in your program with asthma. Now, sometimes they may come to you and need a breathing treatment, and hopefully, since those breathing treatments can take almost 30 minutes, you will be able to have the child outside of the classroom to receive their breathing treatment, because really, when you think about it, it requires one-on-one care. You'll also have some children that need inhalers in your program, but whatever the situation is, the dosage and the frequency for this will be specified by the physician. So you may have some situations where you're giving an inhaler as a preventive measure prior to outdoor play, or you may have situations where the inhaler is emergency treatment after a child has started exhibiting signs of asthma. But just know that those situations will vary from child to child, the circumstances certainly. Another item that was included on the list of first aid situations, burns. And I was surprised to see this, because when I started thinking about it, I realized that I've never had a child in my program that was treated for a burn, which is a good thing, and that can be due to several factors being in place, one of which, whenever we open our facilities in the morning, part of our opening checklist is that we are testing the temperature of the water. That way children are never exposed to hot water while in our care. Another way is that if we have a hot plate in the room and we have a cooking activity, maybe we're making some homemade Play-Doh in the classroom, then that activity is not going to occur in a classroom where we have infants or pre-toddlers or even 2-year-olds. So typically that would occur in the classroom with 3-year-olds if you're going to have an activity with a hot plate or with an iron, where you're doing something with an iron for some sort of art activity. But even when those activities occur in the classroom, you're going to have increased supervision while they are occurring and instruction on the activities before they occur. And then the third factor is that there's no exposure to chemicals that can result in a chemical burn. However, even if you have these good preventive measures in place, it is still important that you know how to treat a burn if in fact it should occur, because if you are in a family child care home, then you have more exposure to those sorts of hazards on a daily basis. Let's see. What else do I want to say? My pages are out of order, pardon me. Eye injuries. The most common eye injury that you will see in your program is children getting sand in their eyes, probably. is the most typical eye injury. I had a situation once where I ended up carrying a child to the emergency room to get treatment for this, and they actually take an IV bag of saline solution, and that hangs down, and then that's opened up pretty fast in order to wash the eye out. I was able to assist with that because he was just so upset, and he really wasn't having anything to do with the medical personnel there, so that was a pretty good experience for both of us. I still can't believe they let me do it. I'm glad that they did, because that prepared me to help the adults in my program that throughout the years where they've had sand or any other foreign object in their eyes, I was able to assist them at the eye wash station. So you just never know what your specialty will end up being when you're in this career. Splinters are another common occurrence that can occur in your program, especially if you have wooden playground equipment. Even if you're inspecting it on a daily basis and trying to make sure that nothing is evident, still you may have the possibility where splinters can find their way into and onto your children. Frostbite and hypothermia, believe it or not, hypothermia can occur in Florida. All it takes is wet clothing, a breeze, and a prolonged period, or even exposure to air conditioning. We, however, are more concerned about heat exhaustion and heat stroke because that's more prevalent here due to the climate that we live in. So certainly we are exercising preventive measures to make sure that these incidents do not happen while in our care. We want to ensure that children have a place for shade on the playground, and if we are taking them out in extreme heat, we are lessening the amount of time that we spend outside. We're always taking water out onto the playground and really doing the best possible that we can to make sure that we implement preventive measures so that heat exhaustion and heat stroke does not occur with our children or our teachers. So let's back up to the beginning of the story and talk a little bit about emergency care. So when you're taking your classes on CPR and first aid, think about, if you're an infant teacher, the way that you are going to perform CPR on an infant that is not breathing and does not have a pulse will look a lot different than the way that you perform CPR on a preschool age child. So when you're going through your training, think about the children in your classroom and how it will look if you have to administer emergency care to any of those children, and keep that in mind. It's great in your facility if you can have those CPR posters up and the first aid posters in a highly visible place where the staff are frequenting. In the staff lounge, on the staff refrigerator, on the bathroom stalls, in the staff bathrooms. Those are great places that the staff can see those posters on a daily basis, because it's important if when you do have to launch into performing emergency care that you aren't questioning the steps and if you're doing it correctly. Case in point, I found myself in a situation where I was at a youth program. I worked at a youth program, and the custodian came into the facility and said, "Miss Tammy, come quick. We have a parent that's collapsed in the parking lot." So my girlfriend just happened to be there, ironically enough, picking up CPR manuals, because part of my job, too, was to go into family child care homes and teach CPR and first aid to providers and their families if need be, if their families were part of their backup care plan. In that instance, in Brenda's house, her husband and her mother were also certified in CPR and first aid. So at any rate, she was with me with her manuals and her cell phone, and I was there to provide the emergency care for the individual who was passed out on the ground. So when we came upon him, he was still breathing, not very well. He had a pulse, not a very good one. But what you want to be aware of is that people love to give advice if they are not in the role of performing. So I had lots of spectators telling me, oh, he needs to have CPR. Are you going to give CPR? What are you going to do? He needs an ambulance. Well, of course we know he needs an ambulance. We've already called an ambulance. I have a person on the cell phone right here who's on the phone with emergency services. So he went from having very raspy, rattly breathing to having no breathing and no pulse. So at that point, I did start performing CPR. And another person came on the scene that was a trained responder. So it was between the two of us. We did two-man CPR. I was doing the compressions and he was doing the breathing. And in this situation, it took a long time for emergency personnel to reach us because we had a transition where the addresses in our neighborhood had changed. So there was a lot of confusion about where we were, unfortunately. And another thing to be aware of is that just because EMS shows up, they don't necessarily take over right away. So you may need to continue providing the actual first aid, whatever it may be, whether it's rescue breathing, whether it's full-on CPR, you may need to continue providing that until they are able to take over. So remember, when can you stop performing CPR? It's when you can no longer continue because you're too tired, when another person takes over that's trained to do so, or when EMS shows up and they are able to take over. I performed this procedure for a very long time because of the delayed response time. And when we're in our training, I've had a lot of people in their training say, I just don't know how I can possibly keep doing this because I make my participants perform CPR on the mannequin for a full minute and they are just wiped out at the end of that. But just please know and be aware that if you have to do this in a real life situation, you will be amazed at the strength and the stamina that you have to perform this procedure on someone, even though you have a lot of people yelling at you, telling you what to do, and just weighing in on life in general. So that concludes my thoughts on Chapter 9. Thank you for your attention. I appreciate that. And just keep in mind that in some instances, you will be the most qualified person on the scene. And therefore, you will be the one that needs to perform the first aid. And I have every faith in you that you can do so as long as you've paid attention to your training and you are committed to what you're doing. Thank you so much for your attention.